Namaste to all. Experiencing occasional anxiety is part of life. However, people with anxiety disorders frequently have intense, excessive worry, fear, and dread about everyday situations. These feelings are out of proportion to the actual danger and can last a long time. The amygdala appears to play a pivotal role in modulating anxiety. The major mediators of anxiety disorders are norepinephrine, serotonin, dopamine, and GABA. Risk factors are genetic influence, environmental factors such as trauma, neglect, chaos, or adverse childhood experiences. Use of cannabis, stimulants, overcrowded places, sertraline, selective serotonin reuptake inhibitors, discontinuation syndrome, rejection, unresolved conflicts. Clinical features are feeling nervous, restless, tense, weak or tired, tachycardia, hyperventilation, sweating, trembling, trouble concentrating or sleeping, experiencing GI problems, having difficulty controlling worry, avoiding things that trigger anxiety. Concurrent distress symptoms are common in all of the anxiety disorders. Several types of anxiety disorders exist, such as agoraphobia, anxiety due to medical condition, generalized anxiety disorder, panic disorder, selective mutism, separation anxiety disorder, social anxiety disorder, specific phobia, substance-induced anxiety disorder. Generalized anxiety disorder is one of the most common anxiety disorder that gives the feeling of being constantly overwhelmed. Anxiety lasting for 6 months or most of the days, either with three of these: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbance, is diagnostic or generalized anxiety disorders according to DSM 5 TR. Two main elements of the mental state examination should be assessed in generalized anxiety disorders: suicidal or homicidal ideation plan, and normal testing of orientation or recall. The detailed history and review of symptoms aid in diagnosis. Besides that, baseline investigations along with thyroid function tests, urine analysis, and drug screen are also done. Treatment usually consists of a combination of pharmacotherapy or psychotherapy, antidepressant agents like the medication of choice in the treatment of anxiety disorders, particularly the newer selective serotonin reuptake inhibitors. Cognitive behavioral therapy have demonstrated efficacy. Psychodynamic therapy, insight oriented therapy is most commonly used in phobias. Patients with significant discomfort from the anxiety can benefit from emergency anxiolytic treatment, particularly benzodiazepines. The 2011 American Psychiatric Association practice guidelines strongly recommend SSRIs, other pharmacotherapy, or CBT as initial treatment. The NICE guidelines recommend against the use of benzodiazepines for long-term use. Instead, SSRIs, SNRIs, and TCRAs can be given. Upcoming treatment and research is towards personalized technology driven interventions like virtual reality, targeting novel drug brain pathways, especially the reward system, and enhancing existing evidence based therapies.